Yeah, he met Yanshan from the University of Pittsburgh and to give this talk. So Dr. Yanshan Wang is a vice chair of research and research assistant professor within Department of Health Informatics in the University of Pittsburgh. Before joining Pittsburgh, Dr. Wang was an assistant professor in the Department of AI and Informatics at the Mayo Clinic. Dr. Wang has served as PI on multiple awards, and also he led several NIH-funded projects, which aim to develop NLP and AI algorithms for EHR information extraction and automation. Dr. Wang is also the fellow of American Medical Informatics Association, which is AMIA, and he is also the current chair of the AMIA NLP working group, and he is also the NLP lead for the National Center for Advancing Translational Science and to Clinical Health Network. He also has been actively serving the informatics and the NLP community, including the AMIA Annual Symposium, MedInfo, and many other international conferences and journals. Yeah, let's welcome him to give this talk.
Thank you, Juan, for the kind of introduction. You can hear me fine, right?
Yeah, I think we can hear you.
Okay, great. So today I'm going to talk about a very critical issue right now in the generative AI in healthcare, which is the ethical concerns. And in the last year, we have think about this issue, and we think our community need to come together, and that's why my lab and my group proposed the ethical principles for adopting generative AI in healthcare. Before talking about the ethical principles, I want to introduce some historical problem that we as human beings we have been faced in the history, and now it is time again to face this problem again. So we all know that this famous picture in which Marie Curie was standing in front of her lab table and doing experiment on a newly discovered element at that time called radium. And radium was one of the first radioactive elements ever discovered in 1890s by Marie Curie and her husband. So they opened the door for important innovations using radioactivity in medicine and industry. And because of that, they received the Nobel Prize in 1903. So radium was quickly put into use in medical domain as a cancer treatment. And because it was successful in treating cancers and many other diseases, people are enthusiastic about this power, and somehow radium became a powerful substance for all different products. So in early 1900, radium became addictive in a number of everyday consumer products. So nowadays we cannot, think that is possible. But at that time, people view these new elements as something can cure all, and something can make everyone's life better. For example, there is a drink called Radiator on the upper left corner, which was basically radioactive water. And sometimes, and some simply, those water are basically like distilled water with tiny amount of radium in it. And it was advertised as a cure for the living dead. So this is another product is a Radion, which on the upper right. So this Radion is an energy bar with added radium. So, and there is also some lotion with radium and a radium-based shampoo. And you can see from this advertisement here, it was advertised as a permanent wave beauty. So those are insane from nowadays perspective, but at that time, those are even luxury products people pursued. And people thought that radioactivity released energy that could treat cancer and could also be good for their body. So they didn't see how adding this energy to their body could be possibly be harmful. And one of the most famous incident is the basically called the glow-in-the-dark watches. So this glow-in-the-dark watch is one of those radium-based novel and popular products at that time. So the luminous paint which worked by converting the radiation into light through a fluorescent chemical, was one of the most successful radium-based products. And it looked like magic at that time. If you take a look at the picture here, nowadays we know those are common, but at that time it was magic. And the factory in the US hired thousands of women for this well-paid job to produce these watches. And for the dedicated task of applying the paint to the tiny dials on the watch, the women were usually instructed to point the brushes with their lips. But the paint made the watches glow because it contained radium, discovered less than 20 years earlier. Its properties at that time are not fully understood. So the women were ingesting radium with nearly every toothstroke at that time. So those women, those workers, became known as the radium girls. And these are the factory in the US that produce these watches and store the radium chemicals in the domain. As you see here, there's no protection at all for those radioactivity elements. And the trajectory happened around 20 years later. When the luminous watches grew fashionable in the early 1920s, the world was already becoming aware of the risk of radioactivity. But the radiation poisoning is not immediate. So years went by before any of the workers developed symptoms. In the early 1920s, some of the radium girls started developing symptoms like fatigue and toothaches, and some actually suffered and died from a condition called radium jaw, as you see from those pathetic pictures. So all these end up with a radium crisis. So let's quickly go to the end of the year 2012 and 2023, when the enthusiasm developed around the generative AI and ChatGPT. So since the release in November 2012, ChatGPT has captured almost everyone's attention. Over just 1 month, ChatGPT has millions of users around the world, and many industries, including healthcare and life sciences sectors, have started to invest a lot of money in generative AI. And in 2023, the enthusiasm continues at particularly in the medical field and healthcare field, as many healthcare systems started to use generative AI applications in the clinics. So it is a very familiar thing, like when the radium was discovered in 1900s. So there are already some criticism around the bias and unethical use of generative AI techniques in healthcare, but there are very few of them criticize how generative AI should or should not be used in the clinics. So that's why about 100 years ago, humans made a similar mistake that we thought we brought a new discovered radium to everyday product without rigorously testing the element. And nowadays, we are actually making the same mistake again, that we are adopting AI in sensitive fields like healthcare without thorough validation and ethical oversight. So that's why we are entering, or we will enter, an AI crisis in healthcare. So that is the whole topic of today, and I have to warn our community to seriously consider those AI applications and how those AI applications could bring a crisis, a new crisis in the healthcare domain. So this is why we have tried to try our best to learn everything necessary to avoid the AI crisis in healthcare. And the military, which we started at the beginning, is one of the first to use new AI technologies. And this is because the military is always looking for new technologies and new ways to improve the efficiency, safety, effectiveness in the operations. For example, AI can help with analyzing the satellite images quickly to identify the potential threats, and even managing logistics like supply chains in a more efficient manner. And AI technology helps the military in making faster, informed decisions and in developing strategies that leverage the speed and the capabilities of modern computing. So in the conflict between Russia and Ukraine, there is a growing competition to use AI in weapons, such as the drones and RQ-4 Global Hawk. And recently, when the Iraq attack Israel, it also used those drones. And those AI-enabled weapons has fundamentally changed the battlefield. It's likely that the weapons controlled by AI will become normal in future battles. So while AI has been useful in many areas, it's important to think about the ethical issues it brings up. And one of the biggest worries is that if AI make a mistake in choosing what to hit, it could accidentally harm innocent people or even the own side during the battlefield. So people may question that when we start at the beginning, when we start from military applications and military ethical considerations of AI, people usually question that military and healthcare have a distinct ideology difference and priorities when adopting AI. So in the military, AI is all about making things more efficient and precise, attacking more enemies and protecting the national security interest. But in the healthcare, AI is focused on saving more lives, improving everyone's health and well-being. So while we acknowledge the different ideological foundations in military and healthcare due to these contrasting objectives, we argue that both military and healthcare sector illustrate a compelling convergence of priorities for the application of AI, and specifically their shared focus on the application, fidelity, attention to practical implementation, and prioritization of the human-centered approach. So with AI becoming more common in military uses, the U.S. Department of Defense (DoD) have set up a set of ethical rules for using AI back in 2020. So these rules focus on making sure AI is used carefully and responsibly in the military. So they cover 5 main areas. The first area is called responsible. So here I want to spend more time on those areas because that's actually where we started our great ethical principle I will talk about. So in the DoD, the first ethical principle is responsible. So people in the DoD must use good judgment and care when they develop, deploy, and use AI technologies. So they are the ones who are ultimately responsible for how those technologies are used. The second ethical principle in DoD is equitable. So the DoD aims to reduce any unfair bias in AI technologies. So this means they want to make sure that this technology do not unfairly favor or disadvantage any group of people. So traceable basically means the development and deployment of AI technology should be clear and understandable to the people involved. So this includes using transparent methods, some clear sources of data, and thorough documentation of the AI methods so that how and why decisions are made can be followed and understood throughout the military setup. And the fourth principle is reliable. AI technology should be safe, secure, and effective for their intended use. So they will be thoroughly tested and checked to make sure that they work well and safely throughout their use in the battlefield. The last principle is called governable. So AI technology should do what they are supposed to do and be able to avoid or stop doing things that weren't intended. So this includes having ways to shut down or adjust those systems if they start acting in unexpected or unwanted way. So these principles are very practical for AI applications because they have been used in battlefields in the DoD setting. So we think they are very good starting points to extend and adopt these principles to healthcare. So in addition to the DoD AI principles, the NATO North Atlantic Treaty Organization also released principles for the use of AI in military that includes lawfulness, responsibility, accountability, explainability, traceability, reliability, governability, and bias mitigation. So there is some overlap with the DoD AI principles. And for the development of AI in healthcare, the WHO has published its own ethical principles that include protecting human autonomy, human well-being and safety, transparency, explainability, responsibility, and accountability, inclusiveness and responsive development. And similarly, the American Medical Association, AMA, also promotes AI system that should be user-centered, transparent, reproducible, avoid exacerbating healthcare disparity, and safeguard the privacy interests of the patients and different individuals. So this figure illustrates the commonalities and difference in those ethical principles between military and healthcare. And in our assessment, traceability, reliability, lawfulness, accountability, governability, and equity are the ethical principles that both fields have in common. And at the same time, the ethical principles such as empathy and privacy, they are emphasized in the healthcare domain, whereas the ethical principles like national security and defense, they are more emphasized in the military. So as a result of our study on the ethical principle, we start to look for collaborators in the Department of DoD, in DoD, that could work with us to understand more how DoD deploy those AI principles. So at the University of Pittsburgh, we have a center called a Center for Military Medicine Research, and this center was set up between based on the collaboration between our university and the U.S. military, and the aim was to further diversify the university research revenue and engage collaboration with the DoD. So that's why we are in contact with this center and started to get some collaborators from the DoD to help us understand how those AI, how those principles has to be deployed. And that end up with an article we have been published in the Nature MPG Digital Medicine. We try to adopt and expand those ethical principles that has been used in military, and we adopt them in the healthcare. And we specifically tailor those ethical principles for generative AI because of the enthusiasm around those generative AI technologies. And since we published that ethical principles, a lot of media has covered our ethical principles and use these ethical principles to raise the attention in our healthcare community for the use of those generative AI. And in the following slides, I will talk about detail how those ethical principles, what are those ethical principles, and what are the insights we provide to implement those ethical principles when we use generative AI. So as I mentioned earlier, we propose the ethical principles as a Great P ethical principle that actually covers those initials from those ethical principles we proposed that include governability, reliability, equity, accountability, traceability, privacy, lawfulness, empathy, and autonomy. So this is the ethical principles we propose, and we urge people in the healthcare community to rigorously test the generative AI technology and rigorously consider those ethical principles before using that technology in the practice. So the first ethical principle is governability. So governability basically means how well a system can bring together different methods and tools to keep working effectively and remain under human control. To put it simply, consider a situation where we are using generative AI technology in a medical setting. So if something goes wrong with the AI system, there should be a way for people to turn the AI system off and fix the AI system without causing any problems for the patients or without causing any interruptions for the normal activities in the clinic. So this ensures that human either physician or administrative team or leadership in the healthcare system can always step in to manage or correct the system, keeping everything running smoothly and safely. So that is all the governability about. And there are actually also several ISO standards that we can adopt regarding the governability to adopt another level of AI management system to manage those AI models. Reliability is the second ethical principle. So reliability refers to how dependently a system operates under certain conditions over a certain time frame. So we can think about this reliability as how trustworthy machine or software is to do its job without failing when we need it. So for AI, generative AI models that can make decisions in healthcare, particularly nowadays, a lot of physicians have used the like ChatGPT or those generative AI technology to facilitate or support their clinical decision making. So for those AI systems should be able to make choices that are at least as safe as those humans should make. And the performance of those models need to be rigorously tested across different setup. And essentially, those AI models shouldn't suddenly cause some harm. So that is the bottom line. So the idea is that we can count on those AI systems to work correctly and safely, just as we would rely on a human provider to make important decisions without causing any unexpected problems. So that is very important to build the trust between physician and the patient as well, and not to hurt the trust already established between physician and the patients. So that's all about the reliability of those AI models. So the next ethical principle is equity. So nowadays, equity or DEI is a very important issue because there are a lot of health disparities that exist in our healthcare system. So equity means making sure that everyone has the same chance to be as healthy as possible, and no matter who they are and where they come from, and they are equitably treated and have equitable access to those AI systems. It's like ensuring that every player in a game starts from the same starting line with the same opportunities to win. So when we talk about generative AI, specifically the kind of generative AI that help make a decision about our health, it's important that it make a fair decisions and it is fairly accessible. This means the AI must learn from the data that does not unfairly favor or ignore certain groups of people. And whether those group of people they are socioeconomically disadvantaged or from different background, or they have less education, less educated, or from some disadvantaged population, they should be treated equally, and they should be they should have equal access to those AI systems. And for example, we don't want some AI system that is only being taught with information from some wealthy and well-educated people, because it might not understand or make good decisions for everyone else. It should work well and fairly for all of us, giving every person the best decision at a good health without letting bias influence the decision. And sometimes the equity, also need to be reflected in the data we collected. So we need to make sure the data, also equitably represent different populations in our community. So accountability means that being able to point out who did what in a system. So it's important because accountability let us know who is responsible for each action. So for example, when a doctor uses AI technology to help treat patients, it's essential that there are ways to show that the doctor or the clinician is still in charge and responsible. If we don't have this, patient may feel like the doctor isn't really involved or doesn't care about the treatment at all. And I think of this as knowing who to thank when something going right, or who to ask for an explanation if something doesn't go as expected. So it's about making sure that even though we are using some advanced AI technology, but there is still a human in the loop and a responsibility. Human is responsible behind those decisions affecting patient health. So making sure this accountability is there in our system, patients can feel more secure and confident that they are being cared by physicians, not just machines. So traceability is another ethical principle that we need to seriously test and validate. So traceability means being able to follow the journey of the data as it moves through and is transformed at a system. It's more like we need to be able to track a package from the moment it's shipped to when it is arrived at our door, right? So this tracking is essential for making everything clear and open, so everyone knows exactly how the system works from the start to finish, from the input data to output data. So in the context of AI technology used in healthcare system, this transparency is super important. It helps making sure that people using the AI technology, like physicians and nurses or our healthcare system, in large, fully understand what the AI can do and what the limitation of those AI technology. So they need to know how the AI makes its decision and what information it uses and how reliable the recommendations are. So this is a critical and very crucial, because in the healthcare domain, decisions can directly affect people's health and lives. So knowing that AI strengths and weakness can help healthcare professionals use this more wisely and keep everyone informed and safe. Right now, in a lot of the recent generative AI applications like ChatGPT, it actually does not have the capability to trace how the output are generated. So this will bring a serious issue in healthcare, because a lot of the outputs we don't know how reliable they are. What is the reference? What are the source data it used to generate those outputs? And those issues actually reflect the traceability principle. It's not in the current design of the generative AI models, and in return, it will hurt the trust of the system, and also try to hurt the patient's lives eventually. So privacy is a next ethical principle. It means that we need to make sure that the personal information, especially the health details, is kept secret and safe. So this is really important in healthcare, because there are strict rules and there are regulations, like in the HIPAA law. Those require protection of patient information. Imagine that our healthcare record are private letters that might only for certain people, and the privacy ensures that those letters or those communication do not end up in the different entities. So when we use AI to help in the healthcare domain, for example, we use AI to create reports, to create summaries, we must be extra careful not to let any private details accidentally slip out. So it's like making sure that no one can get into our communication between patients and the physicians. This is also, there are also many ways that people try to trick AI into revealing information it shouldn't. And there are some potential attacks like prompt injection or cybersecurity concerns that need to be tested to protect the patient information from leaking from the model. And there are recently there are a lot of studies on the cybersecurity of those larger language models, and there are, I think there recently a hospital just temporarily halted the use of OpenAI API of the large language model because there is a privacy leakage in those large language models. So we have to constantly, before deploying the AI model, we have to rigorously test the privacy, cybersecurity component of those AI model. And also we need to constantly check and test those AI models to make sure that it does not fail for those privacy concerns. And recently, actually, both in the commercial field and in research, there is a huge gap. How do we protect the privacy information that used to train those large language models, keeping patient information secure and confidential? So lawfulness is another ethical principle that means that we need to follow the rules and the regulations that are set up by both local and global authorities. So just like there are laws that keep things orderly and fair in society, there are also laws that apply to the use of AI technology. So for AI systems that can generate content, those generative AI models generate content or make decisions like those used in healthcare, business, or entertainment, it's crucial that they operate within those legal boundaries. And this is particularly true when we use those AI systems in the global setting. For example, a lot of healthcare systems, they have clinics and location outside of US. We have to follow the local laws and regulations when we deploy and apply those AI systems. So this ensures that the system do not break any local or international laws, including those protecting human rights and ensuring the humane treatment. So when we talk about AI being lawfulness or being lawful, we are seeing that this system must be designed and used in a way that respect all those laws in different locations. And moreover, there has to be a clear understanding of who is responsible if something goes wrong. So is it because of the AI's action or suggestion, and then the AI is responsible for that, or the engineer who developed the AI system responsible for those illegal actions, or the physician who used the AI system responsible for that? Imagine if an AI system gave a wrong medical diagnosis or advice, there should be clear laws and regulations that determine how to handle that situation and who should be held accountable. So this legal foundation is essential for making sure that the use of AI is safe, responsible, and respectful of everyone's right and dignity, and also follow different regulations in different locations. So empathy is another ethical principle that we need to follow when we grasp how someone feels and understand what they are going through. Sometimes we need to show empathetical actions, even if we haven't been in their exact situation. So when we talk about those generative AI in healthcare setting, having this empathy means it can recognize and respond to patients' feeling in a way that showing understanding and care for the patient. Even though AI isn't a human being and does not have feeling, it can be designed to recognize and respond to human emotions in a very helpful way. So this is very important because when patients feel understood and cared for, they tend to have better healthcare results, and they are more likely to follow medical advice. They will feel satisfied with their care and have fewer issues or misunderstandings with their healthcare providers. And also the clinics and the hospitals, the healthcare systems that provide empathetic care also receive a better rating and may even get higher revenue from insurance for offering this high quality care. So adding this additional layer of empathy to those generative AI can make a big difference in healthcare and help the patients feel better and improve the overall care process. So last but not least is the autonomy. So autonomy is all about having the freedom to make our own choices and decisions. So when we bring AI to healthcare, it is really important to remember that both patients and doctors should be in charge of the decisions about healthcare. And for patients, this means they should get care that matches what they value and what they want for themselves. So their personal beliefs and choices should guide what the treatment they receive, not just what AI suggests. So it's more like choosing a meal based on what you would like to eat, not just a computer program recommend. For the doctors and other healthcare providers, autonomy means that they should be able to use their knowledge and experience to decide the best way to treat their patients. And they should use AI system as a tool to help them, not as a boss to tell them what to do. So they should have the decision to, to say when they can stop using AI system to make a decision, or when they can stop using AI system to assist the process. And for patients, it is the same thing. The patient also need to have the authority to make a decision when they can, when they want to use the AI system, but they are not forced to use those AI as the assistive system. So as AI technology grows in the healthcare domain, it is crucial to ensure that it helps and enhance the human decision-making, not to replace the human decision-making. So this when everyone stays in the control of the choices about their healthcare and making sure that the technology serve us, not the technology control us. So this is all about the autonomy when we develop those AI systems. So this is we also created this card for those greatly ethical principles, and we want to provide those ethical principles to our healthcare community, as the reminder or as the principle when the healthcare system adopt those AI technology, specifically generative AI technology in their healthcare system. And we want to ensure that the bottom line is those stakeholders and the leadership at the healthcare system need to make sure those ethical principles are seriously considered before they are used in the healthcare practice. Okay. And I think that's all for my presentation, and I'm happy to answer any questions. So this is also a fast-moving field, and this is a very preliminary, our initial study on those ethical principles, and I want to open the floor to the audience that any thoughts are welcome to, on those ethical principles.
Yeah, thank you, Yanshan. Thank you for the wonderful talk. So do we any questions from audience first? Yeah. Okay. Yeah, I have a question about this guideline and those principles. So do we have like a best practice or suggestions to like how we can leverage or apply those principles in our system? Like, in our healthcare system, like EPIC and others, I think it's quite challenging to apply. So do we have any like best practice suggestion or guideline for how to apply those things? Yeah, thank you.
Yeah. Yeah, that's a very good question. So in our ethical principles, we provided some framework people can leverage to guide their ethical principle validation. But most importantly, our goal is to provide a framework for people to think about those principles. But there's still a gap in current framework, because there are a lot of, so for example, what is a specific strategy to evaluate governability? What is the specific strategy to evaluate, let's say, empathy? I think that is still a gap there for those specific evaluation and specific assessment. And because the generative AI technology is relatively new in the field, I think as research come up with a lot of strategies, we will eventually be able to test all those different principles.
Yeah, thank you.
I have one question about currently many countries or many head companies start to train their LLM model, but it seems like the data creation from maybe from the web or from everywhere. So it's really challenging to get to treat the whole language or whole race equally. So do you have any experience or could you guide us how to keep the LLM model treat everyone equally, or how do we avoid the unbalanced data collection? Thank you.
Well, Juan, could you repeat the question? I think I missed some part.
Yeah, okay. Could you hear me? Yeah.
Yeah.
Okay, I guess maybe the microphone doesn't work well. So basically, he asked about when we apply and training those large language models. So due to the equity in the data and also some equity concerns. So how do we like address those concerns in the equity in training large language model?
Yeah, that's a very good question. Currently, all those large language model is not specifically trained for healthcare, right? So I can tell you right now in our community, there are basically, based on the paper, there are basically two large language models trained on the healthcare data. One is Gatortron, trained from the University of Florida. They use 1,000 of NVIDIA donated GPU card to train their Gatortron large language model. The other one is NYU-Tron, which is NYU use their clinical healthcare data to train those that large language model. And these two large language model are specific for healthcare use, but all other large language model like GPT model or all other open source models, they're not specifically trained for healthcare, right? So that's why when we, even for those model trained from University of Florida or NYU, they use only the data, collected from their institution, and there might be some bias towards some specific population, right? So I mean, that's why when we think about how to train those large language model, particularly for healthcare domain, it is important to organize a consortium or large initiative to collect data from a large consortium of healthcare systems and combine the data, and then make sure the data is equitable across different populations, like social determinants across different socioeconomic status or the different race, ethnicity groups, and make sure that data is equitable, and then we use the data to train large language model. But right now, that part, the existing large language model right now still have those problems in the training phase.
Yeah, thank you. Yeah, I guess also I have a follow-up question for that one. So, like getting those clean data is quite challenging, especially for healthcare data. So
yeah.
We know there are some methods to generate or create those synthesis data to train the model. So do we have any comments on those methods and how they are, the model quality, performance, how it looks like? Thank you.
Yeah, so I want to comment. So I know there are several people and several big companies actually working on it. One of the biggest company working on it is big player, Epic, which is the largest EHR system. So Epic has a product called Cosmos, which collect all the de-identified EHR data and put that in the Cosmos database, right? So right now, of course, they don't mention, they are gonna use the data to train any large language model, but you can guess as a private company, eventually they will use those large amount of data to train some model. So if we are, as a community, if we are not doing that, those commercial companies will do that for sure. And that's something that we want to keep an eye on that.
Yeah, thank you. Any other questions?
So in your experience with these medically trained models, you said from University of Florida and NYU, which of these ethical principles are hardest to meet by those models?
Yeah, that's a very good question. I think a lot of them tested. So first, the current evaluation of those large language model is still based on our old evaluation matrix for deep learning or supervised machine learning models. And those evaluation matrix are totally outdated because generative AI is a totally new thing, right? So that is the basics. So those large language models was evaluated using those traditional matrix and evaluation plan, and most of those matrix actually fit into the reliability principle. Basically, they want to make sure the model have a good performance using those measurements. But even the reliability, they didn't evaluate how those generated text, they still need a lot of human evaluation on those generated text, how hallucinated those texts are and how accurate those texts are. There's no standardized, evaluation matrix on those generated text. And for other principles, none of them were tested in those published large language models, like governability, like empathy, or those lawfulness. None of them are tested in those large language models. And another very challenge is those models. I know Gatortron was available is available on the Hugging Face for their base model, the small model, but the larger model is not available for the community. And NYU immediately after they published the Nature paper, they have a license, up under this large language model. Basically, if you want to use NYU Tron, you need to get a license from NYU. So if you think about this, is also an ethical principle. When the healthcare system build their large language models, they're not using those large language models for common good. They are trying to license those large language models, make money from those large language models, which makes sense because they spend a lot of computing resource to train those large language models, and they use a lot of their own EHR data to train those large language models. But still, it itself is an ethical concern because they use data from the patients, and then does patient own a share when they make profit from those large language model, right? So there's a serious concern in the current healthcare community regarding those large language models.
So how do you think that these models these principles can be enforced? Because as it stands, there is no mechanism of enforcement, and the commercial companies, for you it is a great plea, for all of us it's a great plea, but for them it's a great leap. They just want to go ahead and make profit on it. So unless there is some kind of regulatory or legal framework, none of this is going to happen.
Yeah. That's a very good point. And also, thank you for mentioning that great leap, because originally we called this a great leap, but later we think that's not a good name for the ethical principle. So that's a very good point. I think there must be some policy, change for healthcare adopting those AI technologies. And I think, as I mentioned at the very beginning of my talk, we will, as a researcher, academia researcher, want to avoid those AI crises. If all those healthcare system does not, recognize those ethical principles, but adopt those AI systems, and eventually give a lot of burden to physician, and then the clinical workflow, clinical practice field, eventually, then there's a crisis in healthcare domain. And if you think about IBM Watson at the MD Anderson, a lot of initiatives and a lot of tools actually fail at MD Anderson and actually interrupt a lot of clinical workflow there. So we don't want that happen as a national or global AI crisis. So I believe the policy, the lawmakers have to consider all of those, and there must be some policy, need to be some policy there to make sure that those ethical principles need to be considered when they are in place. And also, it may hurt the healthcare system, reputation when it interrupts the clinical care.
One more, last question. So one of your principles is autonomy, which is autonomy for human beings, but the systems themselves are also getting more autonomy. And when that happens, they have to have their own ethical principles inside them. And right now it seems that they don't have a conceptual model of, even something like truth, because they can manufacture fictitious references or fictitious data, and so the other principles are even more difficult, because if you cannot even make sure that what you're saying is true, then all the other principles are even more difficult. So for autonomous AI systems, I think these principles are very difficult to meet.
Yeah, exactly. So for the autonomy, we emphasize that, those AI systems and basically patients and physician, human, must be at the center to decide, whether when we want the AI system to make a decision, or when we want to stop those AI systems to make decision. It more reflect the human rights, when we, as human being, we have to be in control of all the AI systems we use. So I think you're right. So that is almost the bottom line for a lot of other principles, because those actually reflect who we are, what humans, can do and cannot do.
Thank you.
Yeah, thank you. Do we have any questions from online people? Yanshan, could you check the chat or no?
Yeah.
Yeah, from online part, anyone? Anyone have any question? Please feel free to ask. Okay, maybe no. Yeah. Okay, I guess maybe that's all our question Q&A session. So yeah, thank you all for joining this one, and happy to see you next round of the NLP interest group. Yeah, thank you all.
Thank you. Thank you for having me.
Thank you for coming.